Hello everyone, welcome to sqadia.com. This is Dr. Sana Khan, and in general surgery course today, we'll be discussing about the colorectal cancers and obviously the benign lesions. This lecture is a continuation of our previous lecture in which we discussed about the different surgical conditions of the rectum. In this particular lecture, we'll be talking only about the benign lesions, and then we'll be talking about the colorectal cancer in detail because the main focus of this lecture would be colorectal cancers. In case of the benign rectal lesions like the endometriomas, haemangiomas, different kinds of the gastrointestinal stromal tumors, and other kind of the metastatic, except all benign lesions other than the metastatic and the colorectal cancers. We will be discussing about all the benign lesions like the hemangiomas, their clinical presentation, what kind of surgery we should perform in case of the benign lesions, specifically in case of the endometriomas. In case of the haemangiomas, like we go for the angiography or embolization. So we'll be discussing about the benign rectal lesions. Then if we particularly talk about the carcinomas, most of the time they are not rectal carcinomas are not independent. They're the colorectal carcinomas, and see a colon and the see a rectum, they can present individually as well, but most of the time they can either be spontaneous or they can be acquired. But the actually causative agent for these carcinomas is a pre-malignant precursor lesion that can be acquired or that can be benign. Most of the time the carcinomas are the adenocarcinomas. We'll be talking about the colorectal carcinoma, particularly their presentation, their signs, their symptoms, how a patient with a colorectal carcinoma will present to you, what would be the causative agents, what would be the risk factors, and obviously what would be the pathogenesis of the colorectal cancers. Then we will be talking about the types of the carcinoma spread, like the tumor can spread through local. There can be a local spread, there can be a venous spread, there can be a lymphatic spread, or there can be a generalized peritoneal dissemination. So we'll be talking about the type of the carcinoma spread because spread of the tumor is very much important when we are planning a surgery or a treatment modality. Then the mainstay of the discussion today would be about the surgical treatment. Like there are different kinds of the surgeries we have available with us, like the endoscopic mucosal resections, which calls EMR surgeries for the non-invasive limited tumors involving the lower rectum. Or we will be discussing about the transanal endoscopic microsurgeries. We'll be discussing about the endoluminal stenting, and then we'll be discussing about the anterior section and the abdominal perineal resection for the proximal tumors of the colon and the rectum. In different types of the cancers, what treatment modality would be there depending upon the extent. We'll be discussing about the inherited colorectal carcinomas, and then the most important thing to know about the colorectal cancer is a TNM staging, which is tumor, node, and metastasis staging. We'll be discussing about the therapy for the colonic carcinoma, which is the state-specific therapy, chemotherapy, radiotherapy, or curative surgery and the palliative surgery. And then ultimately we'll be talking about the therapy for the rectal carcinomas. So there are other lectures as well, general surgery course on sqadia.com. You can always go there, get access, and enjoy number of the good lectures over there. So that's all for now. Thank you for watching sqadia.com. For the detailed lecture, keep watching sqadia.com, general surgery course.